Before you draw hasty conclusions, were you aware that masturbation might subtly impair your health after a certain age? This isn't a scare tactic, and I'm not here to shame or chastise. Quite the opposite. What we're talking about today is something that many older men go through but rarely discuss, and that silence frequently results in misunderstandings, discomfort, and even long-term issues. If you're between 60 and 85 and you've ever wondered if this is still safe for you or why it feels different now, this video is for you. As a prostate doctor with decades of experience, I've witnessed how common mistakes made during solo activity can cause serious problems over time, such as pelvic pain, urinary problems, and even emotional side effects that no one ever realizes are connected. The truth is that what was fine at 30 doesn't always work the same way at 70. Your body has changed, your hormones have changed, and ignoring those changes can have serious consequences. In this video, I'll walk you through 5 specific things older men should never do when masturbating. These aren't just wild speculations or internet myths. Each one is supported by medical experience, patient cases, and what we now know about the health of aging men. If you've ever wanted to keep your private life safe, your prostate healthy, and your confidence strong, this might be the most important few minutes of your day. Let's begin with the mistake of holding your urine before or during. You may think it's harmless, but you might tell yourself, "I'll go after." However, when men age, their bladder becomes less elastic, their prostate enlarges, and their urinary tract doesn't drain as cleanly or completely. This means that any pressure during arousal, especially pressure around the lower pelvis, can push urine backward, trap it in the urethra, or cause leakage. At the worst possible time, some men even experience embarrassing, uncomfortable, and totally preventable post-void dribbling. Medically, there's also a higher risk of urinary tract infections when leftover urine sits in the tract too long, especially under increased pressure. It becomes a breeding ground for bacteria. Add in the friction from masturbation, and you've got an inflamed system that's more vulnerable to infection. I once treated a 77-year-old man named Carl who came in thinking he had prostate cancer because of burning urgency and nighttime leakage. It turned out he was simply holding his urine too often before his routine, not realizing that his bladder couldn't cope like it used to. There's a psychological angle too. Some older men have been conditioned, perhaps from years of rushed encounters, to ignore body signals or rush through the experience. But ignoring the bladder's message is not a sign of strength or control. It's a sign that we need to slow down and work with the body, not against it. If this sounds familiar, if you've ever finished and then realize you suddenly had to go so bad it hurt, then this message is for you. Make it a rule. The second mistake is using a tight grip and fast motion. As men age, one of the most common things they don't realize is how their own habits can start working against their body's natural function. Always empty your bladder before doing so. This will make you safer, more comfortable, and your entire experience feel better physically and emotionally. In your 30s or 40s, it might have felt good to hold too firmly or move too quickly during masturbation, but now your body is changing, and you're losing the control and fulfillment that formerly came with it. May now be the exact factor resulting in long-term harm. Let me explain. Over time, a strong grip might desensitize the nerves that give you pleasure by repeatedly stressing the penile tissues, particularly those surrounding the head and shaft. Yes, too much good can dull the very signals that used to excite you. Some men even start to notice that they can't respond well to a partner anymore, not because they've lost interest, but rather because their own overuse of pressure has rewired their sensitivity. This condition is known medically as death grip syndrome. Although it's not a recognized diagnosis, urologists and specialists in sexual health frequently deal with it. A 69-year-old man named Henry told me that he hadn't had a fulfilling intimate moment with his wife in almost 2 years because he had become so accustomed to a very particular fast-paced, intense form of solo pleasure that his brain no longer responded to normal touch or pace. He hadn't broken anything physically, but he had trained his body to only react in extreme situations, which isn't freedom, that's a trap. The same is true of speed. You can still enjoy it deeply by being more deliberate, slower, and gentler with your rhythm. Going too fast, especially as you get older, can raise your blood pressure, make you feel drained, or even cause arrhythmias if your cardiovascular system is under stress. You're not 25 anymore. Your body wants pleasure, not punishment. If you're still watching this video and finding these insights useful, please leave a comment below letting me know you're here. If you haven't subscribed yet, I suggest you do so and turn on the bell so you don't miss any videos. Masturbation isn't a race. It's about connecting with yourself in a healthy, safe, and satisfying way. So let your body speak, relax, slow down, and most importantly, listen to it. Your assistance enables us to keep producing quality information that will educate and motivate you. Let's proceed. Error 3. Ignoring the warning indications of prostate cancer. The truth is that masturbation can either help or harm your prostate depending on what's going on inside your body. The biggest mistake is ignoring the little warning signs that something might be wrong. For instance, if you notice pain or pressure during or after climax, don't brush it off. It could be a sign of prostate inflammation, known as prostatitis, or even something more serious, like an enlarged or irritated prostate. Most older men don't connect solo pleasure with prostate health, but they should. Some men feel a severe pain behind their scrotum or deep in their pelvis, particularly when they sit for extended periods of time or when they go to the bathroom. If that feels familiar, your body is requesting care, not avoiding it. The danger lies in the fact that some men, out of habit or frustration, continue to masturbate even when they are in pain, believing it will go away on its own. This is similar to running on a twisted ankle, where you're not healing, but it's slowly breaking down further. One man I spoke with, Tom, 74, ignored his symptoms for almost a year, thinking they were just a natural part of aging, but when he was finally checked, his doctor discovered signs of chronic prostatitis that had gone untreated for too long. His recovery took far longer than it would have if he had paid attention sooner. Additionally, it's not just about pain. If you begin to notice a weaker stream when you urinate more frequently, especially at night, or a sense of incomplete emptying, those are all signs. Masturbation may be causing swelling in your prostate. These symptoms could exacerbate irritation and postpone healing. The lesson is straightforward. Listen to the whispers your body makes before it yells. Change your routine. Real strength isn't about enduring discomfort. Rather, it's about knowing when to stop and take care of what matters. So take breaks when necessary and don't be scared to discuss it with your doctor. You're not being weak. Rather, you're being wise. 4. Using dangerous tools or items as one ages what you use when you're alone is just as important as how often you use it. And regrettably, a lot of older guys resort to innocuous-seeming equipment, things, or aids that covertly cause serious harm. One of the most disregarded risks of masturbating in later age is this. Some guys apply gels, oils, or lotions without first reading the labeling. For men with thinner, aging skin, this type of irritation can take days or even weeks to heal, and if there is already minor damage to the skin barrier, it opens the door to infection. In addition, some chemical ingredients, particularly those containing alcohol, parabens, or synthetic scents, can irritate the skin, disrupt the natural pH of intimate areas, and even cause allergic reactions over time. Using inappropriate objects or pressure tools is another problem. Many men who are less sensitive than they were as children attempt to improve the experience by utilizing objects like household objects or gadgets that aren't safe for that area of the body, but there is a risk. For men with circulatory or prostate issues, what may seem ingenious or satisfying in the moment could result in microscopic tears, nerve strain, or worse, damage to blood vessels. I once spoke with a man named Walter, 68, who had been using a homemade device quietly for years without experiencing any problems until one day he ended up in the emergency room with a minor but painful injury that took months to recover from, and the emotional toll of embarrassment and regret was heavier than he'd anticipated. Even sex toys, if not cleaned properly, can become breeding grounds for bacteria, and for men with a lower immunity or healing capacity, especially after 70, that's not something you want to gamble on your skin, tissues, and prostate, all of which require more care and gentleness now than ever before. Continue using body-safe cosmetics made for aging skin. Avoid anything that feels too tight, rough, or artificial. Choose natural lubricants without chemicals, and if you're unsure, always ask a professional. You're not being silly, you're being responsible, because the small decisions you make in private moments can quietly protect or quietly harm your health. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here, and if you haven't subscribed yet, I recommend you subscribe and Turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now let's move forward. Mistake 5. Masturbating right before sleep without recovery time. As strange as it might sound, timing really matters. Especially as you get older, masturbating right before going to sleep without giving your body time to calm down, breathe, and recover can quietly affect your quality of rest and overall energy the next day. Here's why. After orgasm, your body enters a parasympathetic state, which is supposed to help you relax. But in older adults, the hormonal shift and nervous system response can sometimes go in the opposite direction, leaving you stimulated or with disrupted sleep cycles. You may think it helps you fall asleep, but many seniors find themselves waking up more often, feeling unrest, or even having vivid dreams that disturb deeper stages of sleep. There's also the issue of prostate pressure when a man ejaculates, especially in a lying down position. The prostate gland contracts and then slowly relaxes, but without moving, walking around, or allowing circulation to normalize. It can leave the pelvic region feeling congested or inflamed, that can lead to discomfort the next morning, tightness, a dull ache, or even difficulty urinating. Dennis, a 73-year-old man, once told me he couldn't figure out why his lower back and pelvis hurt every time he woke up. After some discussion, it was discovered that he was routinely masturbating while lying down and falling asleep right away. He changed his routine by giving himself 10 to 15 minutes of light stretching or walking, and the pain went away. That little adjustment made a big difference. Older men require longer recuperation periods because their neural systems reset more slowly, and their muscles and glands require greater blood flow. If you do decide to masturbate in the evening, follow it with something gentle. Sit quietly, drink some water, take a deep breath, and let your body ease back into a resting state. This helps regulate your hormones. Rushing into bed right away after release doesn't give your body that chance. It's like working out and skipping the cool down. Your body pays the price the next day. Reduce stress and enhance the quality of your sleep. As you age, energy becomes a valuable resource, so don't waste it all just before bed and hope to wake up feeling wealthy. Bruno, if you've read this far, I want to thank you for your curiosity, openness, and concern for your body. This isn't the type of topic that most people feel comfortable discussing, especially at an older age, but the truth is that staying informed and making small, wise decisions can make a big difference in how long we live, as well as how well we live. Masturbation in old age isn't wrong, shameful, or something to hide. It's a part of being human. But like everything else in later life, it deserves more attention, awareness, and kindness toward ourselves. Your body is different, your nervous system is different, and your needs are different. Thank you for joining us today. We would love to hear from you. Please leave a comment below with one thing you learned today and how you plan to use it in your life. Your opinions are important to us, so please share them. Honoring that is not weakness, it's wisdom. So, I ask you, was there anything in today's video that made you pause and think? Perhaps it was a habit you had never considered before or a tip you'll try from now on. If you liked this video and found it useful, please like, subscribe, and share. Your support helps us keep producing quality content to educate and inspire you. Thank you for watching, and we hope to see you in the next video. Reading your comments gives us a lot of inspiration and encouragement. Music.